So Beverly, you are in Rena Talpin Associates, and recently, was a few days ago, you underwent minimally invasive lumbar decompression mild procedures. We did at 2 levels. So tell me about what pain and symptoms did you have before the procedures, and how you are doing right now after the procedures.
Well, it was so bad sometimes I could barely sit up in bed because I felt like my spine was dropping into the lower part of my back. It was just horrendous, and yeah, I was in pain all the time. I'm very strict about not doing narcotics, not having to go through any of that, and so after Dr. Nairizi talked to me about it, I looked it up on the internet, I researched the whole thing, and I thought, because I've always been against spinal surgery. I didn't want anybody cutting into my back. Because I had a friend who had major spinal surgery, and she never got off her narcotics. It was a terrible thing, and so I said, never, never, never. But the pain was bad enough for me that it was like, okay, we're going for this. I remember being taken down the hall to go into the operating room. They anesthetized me. How they got my body onto the table was totally amazing to me because I was not there. And when I came to, it was already, I was expecting maybe after pain. There was no after pain, not any. And I haven't had any. It's wonderful. I feel at least 20 years younger, at least, and yeah.
It's great to hear. Interesting that her procedure took basically less than 40 minutes, 2 levels, very fast, and the incision was smaller than the baby aspirin. So we didn't even put any suture or didn't put any anything on it. We just put a little bit of the dressing. That's all she needs. So it's not even any major surgery. It's very fast, quick, and pretty relatively safe procedure to do. And she's here, so it's great just to hear that you're doing so well. And thank you for letting us help. I appreciate that.
And Dr. Nairizi is the best doctor I have ever encountered.
That means a lot. That's very nice of you to say. Thank you.
So,
I appreciate that.
no problem.